So today I'm going to share with you some material on childbirth response when babies come in disasters, low resourced, or other than ideal situations. I want to start just by offering some acknowledgments. The land that I'm sharing and speaking to you from today has been taken care of for a very long time and still is by the Anishinaabe people, so I want to honor them in this land. And also acknowledge the mentors and elders and ancestors that have taught me and shared information with me and trained me to be in the place I am, to be able to share and pass along information to others. Specifically, I want to name Ruth Walsh, a CPM and RN, who had this vision that she has given me the blessing to pass on. And this is the work that I'm doing with you here today. Similarly to if everybody is trained in CPR, then ideally, anytime somebody is in need of CPR, there will be somebody around to help. And so Ruth Walsh has this vision that if enough lay folks are trained in what to do when somebody has a baby in any circumstance, maybe in an airplane, maybe in a disaster situation like a flood time or a hurricane, if enough people knew how to support normal physiological birth, how much better would that experience be for that person and that family? So that is what I bring to you today. And so I want to also name and acknowledge Ruth Walsh. Just a little bit about me so you know who I am. I think it's nice to know where the information is coming from when somebody shares it. I am a midwife and have been for 20 years. I'm a mother of 3 born at home. I'm also an outdoor adventurer and a homesteader, and I've done a lot of earth-based skills living very close to the land. And so in today's presentation, I'm bringing sort of those two worlds together. I've been an educator at Midwives College of Utah for about 11 years as well. A couple of images just to ground those words, that language, and who I am and what I do. Midwifery work, midwifery education is very important to me. Homesteading, raising my kids close to the land, learning how to find their food, grow their food, make their clothes, all these things. And this is the language that I bring to you as we bring midwifery and birth work and supporting normal physiological birth into a situation that maybe is not ideal and not what we all hoped or expected our birth experience to be. So welcome. In today's presentation, I'm going to cover 3 parts. We're going to start with, well, what are we talking about? What is childbirth response? What supports, what supplies, what resources might we need in a situation? Next, we're going to talk about the neurobiology of disaster. What happens in the human brain when suddenly our world has changed, not maybe in a way that we are happy about? And then last, we'll talk about the 5 cornerstones and practices of care to help whoever we are, whatever training we might have, to be helpful and supportive in a birthing environment when, again, the situation may be less than ideal. So childbirth response. Midwives are well suited because we are trained in low risk, normal physiological birth. That is what we were talking about in today's program. What and how might we support people in childbirth in any situation? And again, midwives are already well suited, so would be wonderfully prepared from the onset. Next, we're going to talk about, well, what disaster are you talking about? What are the dangers? What are the different shifts or adjustments we might make based on what is the situation? Not the ideal situation we had planned for the birth, but what do we adjust and adapt to? What are the important things to concern ourselves with? We'll talk about communication and people. How can people be helpful in this situation? Resources, critical supplies that we want to be considering gathering together at the moment, and maybe even gathering a kit together before something might happen. I've been an EMT for several decades, and having a jump kit in my car, I've come across incidences where it's been helpful to have that kit available to me. That might be something you pull together. And then last, we'll talk about the environment, that birth bubble that we create to really support the unfolding of normal, low-risk physiological birth. So first thing, always assess the danger. What is the risk? Is it infectious disease? Many of us have just recently lived through the COVID pandemic. We made a lot of adjustments in our everyday life. Those of us that were in the childbirth profession or were maybe ourselves giving birth had to make adjustments to what we did to give birth prior to the COVID pandemic to what we did during. If you're in a situation where an infectious disease breaks out, that is a time when a healthy person may choose not to go where sick people are to give birth to their babies. So having a childbirth response team ready could be a really appropriate time for an infectious disease outbreak. Floods and hurricanes. Not too many years ago on the island of St. Croix, which is a U.S. Virgin Island, I have friends who lived there, and they lived through an incredibly disastrous hurricane where their roadways were shut down. They lost electricity. They lost the ability to communicate through phone lines. And there were people who were pregnant who weren't able to get to the care that they needed. And so they actually had me come down and teach this workshop, training their local people. Well, what do we do when this happens again? How do we support people? How do we know how to navigate dangers around the floods or dangers with hurricanes or tsunamis? Maybe it's a fire and the concern is the dangerous smoke that's in the air, or how the landscape has become endangered through burning the forests or homes. Maybe it's a blizzard. I remember in college, we had this incredible blizzard and the roads were shut down. And I remember being a college student and walking on the roads looking for something fun to do and having this little truck making it barely down the roadway. And he stopped and we talked to this man and he said, my sister's giving birth in a cabin in the mountains. Her midwife can't get to her. She can't get out. So by golly, I'm going to make my way to her to help. And I remember my heart just exploding with, wow, I want to help. How can I help? Of course, I knew nothing about childbirth at the time, but we never know when a blizzard might happen and somebody's ability to access care might be impeded. And if we're the neighbor, maybe we can show up to help. Right now in today's world, there are people living through wartime and horrific experiences that are dangerous and not safe, perhaps, for them to get to their place of care or their provider. Not to mention nuclear, chemical, other human-made things that we want to know about, assessing that risk and making adaptations and adjustments as needed to be safe and support a safe birth. Next, we want to determine supports. What people are available? When we look around in whichever one of the disasters or low resource situations we're in, maybe we're on an airplane, who's available? I think about these three categories. Who has some training? Maybe it's in childbirth, but maybe it's a dentist. Maybe it's somebody else in some other form of healthcare. Those people will be helpful because they'll understand things like infectious and how to be sterile and the importance of washing hands. Even that level of training can come in super handy. But don't be rigid with, oh, somebody has to have medical training to be helpful, because many people can be helpful by gathering water and bringing it and maybe boiling it to make it safe to drink, maybe gathering absorbent materials to bring them in to the space, maybe helping distract other folks like the other gawkers who we don't want, the people who just want to kind of look and see and, you know, their jaws are on the floor. Those are the people that maybe are not as helpful in this situation. I like to think about inviting those people to, instead of staring at the person in labor, turn their backs and create a human boundary of safety and support, looking outward at the scenario or crowd and allowing that person in labor to have privacy. So what people are available, who has training, who can be helpful, and who do we need to invite to help create a safe space for the person in labor? Communications are your other level of support. Our phone lines working? Are cell phones working? Maybe cell phones aren't working because the cell towers are down, but the internet's working. We can call for help or call for assistance. If we can't call out and communicate in that way, can we send a runner or somebody on a bicycle or a horse? Whatever resources we have available, we want to access and activate for additional help and supports. I like to think about what supplies do we actually need. Now, this is going to be a supportive experience for low-risk people, and we want to be clear about that. Keep it super simple. The KISS methodology I apply to what do we actually need to support a low-risk physiological birth. Start with absorbent materials. This can be any ideally clean materials that you can find. Cotton is very absorbent, so towels, washcloths, shirts, clothing, sheets, blankets, anything we can find in a situation we're in. If we're outside, I like to think about sphagnum moss is a antiseptic plant that is also highly, highly absorbent. That would be a great material to use for a birth experience. But maybe I only have access to some grasses, some tall grasses I can harvest and bring in. Really, any plant that is non-toxic, ideally you can access that information. Like I wouldn't want to use poison ivy, for example, but non-toxic and obviously doesn't have thorns would be a useful material to bring in if we had no access to modern made clothing or cloth to be absorbent for the birth experience. A container, ideally a bowl, metal bowl, plastic bowl. Maybe we find a plastic water jug, we can cut the top off and use that as a container. Any material, maybe it's a wooden container, maybe it's a clay or made of pottery container, but a container is going to be useful. Catching the placenta, it's going to be useful if our person in labor needs to use the bathroom, which will happen. That will be a need, but they might even need to vomit. So a container to help move the waste materials away from the person in labor or catch the placenta, that sort of thing. Water. Water is an essential supply. Ideally clean, and hot water would be great too. We need water to hydrate everybody. We need water to wash our hands and stay clean. We need water to clean the birth space, clean the baby, clean everybody who might be in the space that needs that. Hydrotherapy would be an added bonus. Next, we need an ability to sterilize. Sterilize any equipment, for example, number 5 for cutting the cord. We can use water. We can boil water and boil our instruments to make them sterilized and clean. We could also use fire to sterilize instruments or even to cut the cord. So something to sterilize, maybe rubbing alcohol, but something to sterilize our utensils and something to cut the cord with. I've had people even break a rock and use the inside of that rock, which is a pretty clean environment, to cut the cord with, like an obsidian. So any sharp blade, any sharp implement that we can sterilize in water, sterilize in fire, we can cut a cord with. I've even had clients cut cords just by using a candle flame, just the flame itself. Paper and pencil. I say pencil because pens don't work so well if you're in a wet environment, but paper and pencil, and not so much to capture medical information, but obviously this is not the birth that this person probably dreamt of when they got pregnant. And so can we capture some beautiful thing that was said or a moment that happened, the time of birth, but anything that we can write down to help capture this experience for the person. And maybe that's a medical consideration, but more so even just to try to savor and capture for the person for later. As I said, as an EMT, I carry a jump kit in my car. As a childbirth response person, these are some things you might consider putting together to have available. Gloves, matches or a lighter to build that fire, which we'll talk, that'll keep coming up in this talk today. Clamps or a hemostat, scissors or a knife, cut that cord, alcohol, rubbing alcohol to sterilize, any kind of medications or herbs that are shelf stable. I carry tinctures. Blood pressure cuff and stethoscope is not an absolute need, but it's a nice way to capture vital statistics and how our person is doing. And a uterine balloon, they're now making these that are affordable and something that you can tuck into your kit, because in a rural environment, in a disaster type situation, a uterine balloon could truly save a life when everything else you had on hand wasn't working. Last but not least, in this part 1, I want to say in any environment, but certainly in a low resource or disaster environment, don't overthink it. So look around. Who are the people available that are going to be helpful? What are the supplies we can gather, ideally clean? Are there any herbs or medications we can gather, especially antihemorrhagics? And last, how do we create an environment that's going to allow normal physiological birth to unfold, which we call the birth bubble? And we'll get further into that explanation in a little bit. Now, some life-saving interventions that when I teach this as a several-day workshop, we teach these skills, but making sure that somebody, ideally when we're looking for those helpful people Who knows how to take a pulse? That's going to be helpful information. Does anybody know neonatal resuscitation, NRP? Does anybody know CPR? Bring those people, those helpful people, into your birth bubble. Maneuvers. Again, we can't confirm an ideal situation, but can we find somebody who understands the maneuvers for delivering breech, or to reduce a shoulder dystocia, or what to do with a cord complication like a prolapse, how to handle a placenta that's stuck or partially stuck. So some of these maneuvers are things that I make sure that I'm well trained on if I were ever in a situation to help somebody in my practice, but also in a situation that we didn't have other providers or access. For anti-hemorrhagics, starting with actions, knowing your manual actions. Can we do nipple stimulation? What can we do to help stop that bleed? If the placenta is delivered, can we give the birthing person a piece of that placenta to swallow to help reduce that blood flow that's happening in the postpartum bleed? Medications that are commonly used, Pitocin, cytotecmethorgen, are there any that are shelf stable that we carry or have in our kit? And I want to speak to herbs. If wherever you are on the planet, I know when I travel and teach this workshop, we talk about what are the local herbs that you would use for anti-hemorrhagics. Because in my training and in my experience, I haven't been everywhere in the world, but it sure seems like everywhere humans are, there are plants available to help with all the things we need, but certainly for bleeding postpartum. So if these aren't the plants that are in your area, I highly recommend, if you want to learn more about it, talk to a midwife, talk to an herbalist who's local, and find out what plants would be good to know about. And maybe you don't carry them or have them, but you can identify them, know where to find them if you were in need at some point. These are the ones, again, I carry in tincture form, so they're stable, and I have them if and when they're needed. Yarrow, shepherd's purse, angelica, specific to releasing the placenta, cottonroot, motherwort, witch hazel, and blue or black cohosh. So we've talked about people, communication, supplies. Next, we're going to talk about what we call the neurobiology of disaster and the sacred order of survival. So this is what happens in your brain when there's a terrible pandemic, there's a horrific tsunami, there's a blizzard, and we're all trapped. What happens in our mammalian brain, generally speaking for humans, and what can we do about it? So that's this next section. So these are some beautiful pictures of capturing the human brain when the synapses in our brain are forming neural bonds, which is what happens every time we do something. When we repeat that action, it becomes a deeper neural bond. These are physical pathways in our brain. So I want to share with you some work by Lawrence Gonzalez, who looked at people who survived horrific, life-threatening situations. So blizzards, being lost, being attacked by bears, all kinds of different types of scenarios. And he looked at what's the difference between the people who survive and do well and the people who do not survive these scenarios. And so I bring this to you as a way to help us understand what might happen when we experience a horrific life event and how might we get ahead of that so we can be helpful in service to others. So their organism's main task is to map the self and map the environment. So this is a physical structure, a physical map that our brain creates, these neural bonds that we're looking at here, and keep the two in harmonious balance. So when the physical map that exists in our brain maps what we look at and understand in our reality, we do pretty well. But when that gets out of balance, when we have a tsunami and life as we know it just got wiped out, the map in our brain no longer matches what we're seeing and experiencing in our real life. And this is where things can go bad. So the hippocampus is the part of our brain that creates the mental map of our environment. Through our motions, through our actions of living, position and direction of travel, that hippocampus creates a map. When we are in a disaster situation, when something happens and everything changes, our brain suddenly has to, it sort of gets stuck and it has to figure out what to do. Because creating a new map is absolutely possible. That is what neuroplasticity is. Our brains are so incredible. Yes, they can create a new map of a whole new reality. Here's the catch. When we are under duress and our nervous system is triggered and we're in fight or flight, it becomes really, really hard for our brains to create that new map. So when the map of what our brains think reality should look like and what reality looks like to our eyes and our ears and our bodies, we get really stressed out and our emotions rise. Now, what happens when the stakes are high and our emotions are rising and we can't make the maps match, our amygdalas get triggered and we go into fight or flight. We release hormones. We start doing things that are the opposite of what we should do, which is why many people who are highly intelligent and highly trained end up dying in these experiences where they knew what to do. And it's why a lot of our emergency personnel are trained for staying calm and learning how to remap is essentially what's happening so that they can be in service to others. Because when the maps don't match, our bodies experience danger and we go into panic. So I'll read this quote from Gonzalez. Since the organism's survival depends on a reasonable match between the mental map and the environment, as the two diverge, the hippocampus spins its wheels and the amygdala sends out alarm signals, even as the motivational circuits urge you on and on and on, and you move faster and go faster. The result is vertigo, claustrophobia, panic, and wasted motion. Since most people aren't conscious of the process, italics are mine, there's no way to reflect on what's happening. And all you know is that it feels like you are going mad. So most people aren't conscious of the process, which is why I am motivated to share this with you all, because now you're going to know, and you're going to know what to do. Step 1, be here now. Don't bend the map. What does that mean? I talk about wish midwifery. I wish the blood pressure wasn't going up. I wish this baby's shoulders weren't stuck, right? We can wish it all we want. It doesn't make it real. So don't bend the map means let's not pretend a tsunami didn't just wipe out everything we know to be true and we don't know how to get water and we don't know how to take care of ourselves. Let's remap. Let's pause and figure out how much time we need for our brain to create a new map for the world we are now in. And now we're going to have a baby in this world and it's going to be okay. So that's what we're going to talk about next is how do we do this? First and foremost, stop and get into your senses. Your bodies are brilliant and they have the incredible ability of neuroplasticity to remap for this new environment. So we just got to give ourselves time. Getting into our senses gets us out of our thinking, panicking brain. So I'm going to pause. I'm going to focus on what can I see right now. 5 things that I can see right now. What are 4 things I can hear right now? What are 3 things I can smell right now? What are 2 things that I can taste right now? What can I feel with my body? The air, the temperature, the clothes on my body, the ground beneath my feet. So getting into our senses, I call that the sensory awareness practice, or the SAP. Focus on your senses and give your brain a chance to start the remapping process. Lawrence Gonzalez also came up with what he calls the 12 universal survivor skills that, as he looked across the board at hundreds of people that survived horrific experiences, what did they all do? And here are the first 6, and then I have another slide of the second 6. Play. Laugh, tell jokes, play, whatever you need to do. See the beauty, back to that sense of sight. Look around, look for something beautiful. These are all ways to help our neurobiology adapt to this new situation. Believe you will succeed. So I call that fake it till you make it. Surrender. Okay, here we are. Tsunami just wiped out everything we know to be true. So I'm going to surrender to that and we're going to do whatever is necessary. And if nothing else, we're going to never give up. We're just going to keep trying the next thing till we figure out what to do to help this person in labor. The other 6, perceive and believe. Look around, see, hear, notice what's happening, believe it, it's true. Again, it's that remapping process. Stay calm. We're going to talk about some other ways to calm our nervous system to keep ourselves calm. Think, analyze, plan. The section 3 of this talk today, we're going to talk about what is your plan and give you a plan to enact as you're thinking and analyzing your situation, so you can take corrective, decisive action. Be bold, be cautious. Always celebrate your successes. That's a key thing that I see in a lot of different places where people are doing well, is they're celebrating whatever is good and they're counting their blessings. There's been a lot of interesting recent studies about practicing gratitude, about taking the time to not just let our brains go into the negative and focus on what's wrong, where brains are really good at that. I believe we're designed to survive by focusing on what's wrong so we can fix it. But we do really well when we also take the time to train our brains to also observe and identify the good things. And it might not come naturally because we're designed to survive as human beings, so therefore the practice is important. Another thing that is true for human beings is that we don't really learn new habits very well when we're in crisis. So that's not the time, ideally, to start practicing these good habits to help our neurobiology remap. The time to do it is now, right? When we're in a low stakes environment, when life is stable. So I encourage us all to practice gratitude every day, whatever way works for us, saying it out loud, writing it down, imagining it in our minds, but practicing gratitude is a really positive step we can all take to support ourselves and one another. And so our last section, the 5 cornerstones and practices for care. This is the plan that we want to bring into action. With all the things we've talked about, the supplies we've gathered, the kit we have, the people we have that are helpful, the communications we've practiced, what we want to do next are focus on these 5 things. So we've already talked a little bit about attitude and checking our attitude. We want to be focusing on the glass is half full, not half empty. That's a practice. That's the first thing we want to do when we're in a disaster situation, to help that neurobiology remap for our new.
We have 3 minutes left for the presentation.
Perfect. So the next thing we're going to do is we're going to look at our shelter, which is our birth bubble, our water, our fire, our food. And I think about these within the rule of 3s. The human mammal without shelter, when the exposure to the elements is dangerous, we might only last for 3 hours. Water, 3 days if we don't have it. We're not going to really last much longer. And food, 30 days. So the rule of 3s I like to think about in the importance of these elements in these cornerstones. It's just some fun pictures of shelter. Use whatever you have, right? When your nervous system is aligned and grounded, your creativity is going to be more accessible to you in terms of looking around and finding, well, I need shelter. Can I use sticks? Can I use grasses? What can I bring in to support this birthing person in their environment? So bringing it into our birth bubble design, shelter, what can I look around? Maybe I use blankets and create a blanket fort. How can I create and protect this space for this person to have their normal physiological birth process as much as possible? How do I make a warm, clean, warm, protected, private space for this person? How do I bring water in that can be safe to drink, but also clean to wash our hands and to wash bodies with? Can I bring in fire to help sterilize, to bring warmth, to bring comfort, to cook food or sterilize water with? And what food is available to nourish not only the person in labor, but the family present and any of the supporters there as well. Because anybody who's trained as a midwife knows about physiological birth, and that when we're afraid and we're scared and we're tense, we experience more pain and our bodies slow down in labor, versus when we are relaxed and feel safe and comforted and taken care of, the hormones that are released are almost as strong as morphine, and we are able to birth our babies in a much more calm and less painful experience. So understanding how to regulate our nervous systems for ourselves as the supporters, as well as the person in labor who might be really upset about what's happening, is one of the most important things we could do. So here are some tools I want to wrap up with. Very individualized, how each of us are going to calm our own nervous systems, but think about the lighting. How can we shift the lighting? How can we shift the sound or bring in music to take away sounds that are not as calming. Verbal affirmations, any herbs or nervines we can bring in to support the nervous system. Using our breath, using grounding on the earth itself. Maybe animals, maybe the person in labor has a cat or a dog that helps them calm. Using meditation. Using these tools for ourselves as the supporters as well as the person in labor. I already spoke to you about the sensory awareness practice where you get into all 5 senses and you really focus on those to help calm the nervous system. Doing that every day as a practice. I like to do it outside to help me ground as well. I also use singing. I sing to myself to calm. I sing to my people in labor to calm. And these are practices we can do now, again, where we're not in a disaster situation where our hippocampus and amygdala are already on fire, when everything is calm and the stakes are low. So here are my references, and I just want to thank you for your time and invite any questions.
Yeah, thank you so much, Ruth. Perfect time. Good. So, good.
Sorry, I had to talk quick.
Yeah, because we only have like a limited time. So, but that's so wonderful, so insightful presentation. So, I would like to invite all the participants to, if you have a question to Ruth, just freely to raise your hand, and then you can just unmute yourself, or you can write your question in the chat. Okay. Okay, Marcel. So
Yeah. So I'll just probably more than a question, I think it's a comment. I just found this very interesting. I think especially for midwives that have been trained in developed countries, you know, where you have all the resources and equipments, having this kind of like knowledge about to kind of like think outside the box, because I think disasters and wars and anything can happen anywhere at any time. And just kind of like make me reflect about like, oh, you know, I still need to think outside the box, and what do I do as a midwife if I'm involved in this kind of situation. So good presentation, Ruth. Thank you so much.
You bet.
yeah, thank you. So we have some this is the rest one. I love the presentation. Thank you. Please tell more about the uterine balloon.
Yeah, so a uterine balloon, the first time I learned about one, it cost like $5,000 and it was a highly medical, thing that you could purchase. And it was a wonderful device that an OB shared with, it was a midwifery retreat he brought it to and shared with us. But since then, that was 15 years ago, since then, other folks have created very inexpensive forms of a uterine balloon where it's basically a syringe that you fill with water, I think sometimes they even use a condom in some of the kits, but some type of a balloon that can be inserted through the cervix and then filled with water, and then the syringe has a stop on it so that the water doesn't come back out. And so basically what you're doing is you're tamponading the inside of the uterus to stop the bleeding. And ideally that stays in place until you can transport to higher care. So it's sort of a emergency situation that tool that you could use when you couldn't stop the bleeding with any of your other tools. I've never had to use one, but it feels good to have that in my kit just in case. And I do practice rurally anyway, so that is one thing you can look at.
Yeah. Thank you, Ruth. And one more question is, do you consider a precipitous birth as a kind of crisis or pathology?
I don't necessarily consider precipitous births as a crisis or pathology. Somebody who's experiencing a precipitous birth, it may feel like a crisis to them. So having people around that can keep that calm birth bubble, I think is very, can be super helpful. It's this kind of an idea of, somebody knows CPR, they're right here. Somebody knows childbirth response, they're right here. I've known people that were on the way out their door to the hospital and the baby's coming, and for them it was kind of a crisis. What if their neighbor knew how to maintain a birth bubble and just wait until support came? This would be a wonderful training for people to know what to do, I think.